With the outbreak of coronavirus, the entire nation is under the fear, it's under the grip of coronavirus. There is a fear amongst almost every citizen in India. So in order to safeguard themselves and at the advice of medical professionals and the health department, the government, people are flocking to the medical stores in order to secure their lives, in order to secure they being infected from the coronavirus, in order to purchase the masks, hand gloves and sanitation materials and hygiene materials such as Dettol, Savlon and other disinfectants. In every medical stores, at least in Bangalore, they say there is no stock of the gloves, of the masks, which are most essential in order to prevent spreading of the deadly coronavirus. And it is being sold at exorbitant cost, very high pricing. The face masks which were earlier sold for few rupees, 2, 3, within 5, when you buy in large numbers, it was sold within 5 rupees, is today sold at 50 rupees. And some masks which are specially said to be made to prevent the spread of coronavirus is sold at 200 to 500. This is nothing but black marketing. When the people are in the fear, under the grip of this coronavirus, so in order to prevent, protect themselves and their families, the people are flocking, they are in a very large number, they are going to the medical stores, and the businessmen, especially the suppliers, the distributors, the manufacturers are making, illegal money by selling these products in black market. There is a ceiling. By law, every product that is being sold, especially which comes under the medicine, has got a ceiling price. They cannot sell it more than that. It is being sold at almost 50 to 100 times more than the price it actually is priced. What the hell the government is doing about all these things? When you look at the law, we have Essential Commodities Act 1955. We have drug pricing. We have a act for drug pricing, which actually channelizes the distribution, proper distribution, so that the people get the sufficient quantity and quality of the drugs that can be invoked, and the government is keeping quiet. Probably hand in glove, the concerned ministers, concerned departments, all corrupt people are hand in glove. And if you want to buy gloves, you have to pay 100 rupees. What's happening in our country? See, on one side, the government, the union government is saying that we need to control the spread of coronavirus and people should involve in certain acts by protecting themselves so that the coronavirus is not infected to them. When such being the case, when you want to speak to someone on mobile, the first message comes that what you should do to prevent yourself from being infected from coronavirus, how to safeguard yourselves. And in order to safeguard these essential commodities, gloves, masks and disinfectants, these are the most essential commodities in order to secure the people themselves, and that is sold at black market. 1:50, 1:100 times. Gloves which are 2 rupees gloves today they are saying it is 20 to 50 rupees a pair. Use and throw gloves. So the concerned government should take action on these things. In fact, if these these gloves and masks are not falling within the Essential Commodities Act 1955, it must be brought into. And they must look what they can do. There is a pricing order. All medical, commodities, medicines, there is a pricing order. And there is also this there is a specification by this order that how it has to be channelized. The people should be in a position to obtain it with ease. This is where the government should look into. When there is a law, implement it. Make people comfortable. Already they are suffering, they are under the threat, they are under the fear of this coronavirus. And these are the essential commodities in order to protect the people from coronavirus. So, the government, the concerned agencies, the health ministry must seriously look into this. Essential Commodities Act 1955, they must look into this. They must bring these products under the purview of Essential Commodities Act quickly, within a day, so that people are at comfort levels to procure them at the reasonable price. You can't black market like this. And this becomes actually dangerous. People who cannot afford to buy, if a person is not in a position to pay 200 rupees for a face mask, can he? It is impossible, There are middle class people, lower middle class. What do they do? So therefore, this product, this Essential Commodities Act 1955, these products should fall within that purview. And there must be sealing order. Drug prices sealing order must be invoked. And government should also instruct the pharma companies, and also it should manufacture enough necessities which is required for the people. And India is a large, has a large population, 130 crores. There must be some planning, there must be some system. The government should in fact swing into this action, not give, the social media and from mobile the messages to the people that you secure yourself, you wear gloves, you wear masks, you use disinfectants. This is not the way. It must ensure that these products are available at affordable prices as per law.